Good morning, Ganja Autoimmuners. This is the first video in a series of videos I'm going to do on medical use of cannabis and how to choose your strains and work the medical cannabis to your benefit. We're going to go over the very basics of Indica versus Sativa. Those are generally the two types of dominance you're going to see in your dispensaries, and there are thousands of strains. So unless you really understand what those mean, you're going to walk into your dispensary and be very overwhelmed. So let's begin. Indicas, which I'm going to start with, are my personal favorite because indicas actually do have a higher percentage of CBD, traditionally speaking. They are from the colder, more mountainous regions, and they grow very well outside the equator, in the equatorial regions, versus sativas, which actually grow near the equator. Indicas are a little shrubbier. They mature a little faster. Like I said previously, the ratio of CBD to THC is a little higher than you would find in a sativa. An indica has very thick leaves like this, to where if you were to try to read a newspaper through that, you really couldn't read a newspaper through it. And that's a very indica trait. As a matter of fact, these leaves are actually more Afghani, which is, again, indica. The thicker the leaves, the more Afghani genetics it probably has. Most of what you see in a store is going to be a hybrid of the two, which that's somewhat of a hybrid leaf. But with the indicas, you're going to end up using that for things like pain, severe pain, neuropathies, any type of body pain. For RA, it's amazing to use the indicas for that. These have more of a body feel to it rather than a cerebral feel to it. Now, a word of caution, indicas can make you sleepy. So you have to kind of balance out your ratios of cannabinoids. And that's where hybrids come in, like this. Most cannabis you find in a dispensary is going to be a hybrid. It's very rare to actually find a pure sativa or a pure indica. So you're going to end up with these glorious hybrids where they're trying to breed in the energy of a sativa without the raciness and with the pain relief. This particular set of leaves right here, those two actually came off the same plant, which is a hybrid purple star. So you can see where the plant actually has both the indica and Afghani genetics, but it also has some sativa trait to it. And honestly, the purple star to me is a bit jittery. So it does come through. So the THC and CBD balance is a little off in it. Now, let's go over sativas. Sativas, like this glorious yellow leaf that I pulled off my plant. We've had a dry spell here, so I was pruning a little bit. This is from biodiesel, and biodiesel is mostly sativa. As you can see, if you were to put this next to a newspaper, you could read the words through that, which shows its sativa trait. Sativas are actually from the more tropical equatorial regions of the world and have been bred for THC content. These are cerebral in effect, which means it's really good for things like depression, anxiety, and that sort of thing. So if you've got a lot of depression or anxiety, a sativa-based cannabis plant might be the way to go. The only thing that you really have to watch out for with sativas is THC can be racy. It can cause your heart to flutter. It can cause you to feel very jittery, and it can exacerbate if you have any autoimmune heart issues. So just be very careful and start small and see how you react. Let's see if I've covered everything. That pretty much covers the sativas. The sativas actually, they take a little longer to grow and are a little less shrubby than the indicas. So you'll get less yield if you grow a sativa versus an indica. But that's just the nature of how they are. Now, when choosing something at the dispensary, chances are you're going to choose a hybrid. If you've never ever used cannabis before, I would suggest actually choosing Blue Dream or a 50-50 hybrid. One that's 50% sativa, one that's 50% indica. And then I would get a very small amount of that, try it. If it makes you jittery, you know to go more indica. If not, you know you can go a little bit more sativa, and then just experiment from there based on your reaction. Unfortunately, everybody reacts differently to all of these different strains. So I can't definitively say to you, definitely try Purple Star, it's the strain for you, it'll help with body pain. That's not necessarily true. Everyone is different. So you are going to have to go through a little bit of experimentation to find out what your body needs and where and what genetics that is going to come from. Now, another word of caution on cannabis. Some strains, and for me those are sativa dominant strains, actually will make my pain worse. It'll get rid of certain kinds of pain, but I'll also feel other kinds of pain more, which is another reason I don't use sativas. But that again is entirely an individual reaction. All of our autoimmunes present differently along different pathways, which is why these medicines don't necessarily work for everyone. For one, Enbrel may be their game changer, and for another, the TNF-based medicines may not work at all, and they may have to go to other medications. Same with diet, same with lifestyle. We are all different in our autoimmunes, and that being said, the type of cannabis you are going to need or be able to use, if it's your thing, that is also going to be different. Now, just another disclaimer, cannabis is not for everybody. It really isn't. There are people who do not need the extra cannabinoids. There are people who it's not going to work for. There are people who will react to it, and that's okay. It's just like every other medicine. It's not a cure. It's not a magic wonder drug. It is like every other medicine out there and has to be treated as such in order for you to be successful in treating your autoimmune disease with cannabis. And of course, always check with your doctor. I do understand the legalities, and if you choose not to, that's your choice. But definitely, if you can talk to your doctor about it. I hope this has helped, and hopefully in future videos I'll get an editing software and I'll kind of get my groove down, and we'll go from there.